Alright, it's time to talk about Staphylococcus aureus infections. So first off, Staph aureus is a gram-positive bacteria, a cocci, catalase positive and coagulase positive. So we should think about protein A, and protein A binds to the Fc portion of the host IgG. So let's start with a clinical case. An IV drug user presents with a high fever and signs of heart failure. A notable heart murmur prompts an EKG that reveals tricuspid valve vegetations. The patient is immediately begun on IV penicillinase-resistant penicillin that proves to be effective. Okay, let's talk about the clinical presentation. Locally, skin, subcutaneous, impetigo, cellulitis, folliculitis, and furuncles, carbuncles, respiratory, pneumonia with cavitations, and systemic, acute endocarditis, meningitis, osteomyelitis, and septic arthritis. So those are the clinical presentations. So now let's talk a little bit about the pathobiology. Bacteria colonize the skin following a breach or nasopharynx, following intubation, viral respiratory infection, and overgrow, and invade the host defenses using protein A, which, as I said, binds to the Fc portion of IgG. Coagulase forms a fibrin coat around the organism, and hemolysins and leukocidins destroy red blood cells and white blood cells. And neutrophils localize to the infection site, a purulent abscess forms, and the skin or subcutaneous infections or pneumonia bacteria may more deeply invade and reach the bloodstream using hyaluronidase, breaks down the connective tissue, staphylokinase, lyses form clots, lipase, which breaks down fat, and hematogenous spread to visceral organs, and then to a systemic infection. So for diagnosis, we take a blood culture positive, gram-positive clusters, catalase positive and coagulase positive. And for treatment, antibiotic treatment, MSSA, which is methicillin-sensitive Staphylococcus aureus, or penicillinase-resistant penicillins, MRSA, which is methicillin-resistant Staph aureus, vancomycin. Okay, and we'll just end with a few quick facts. The tricuspid valve endocarditis frequently affects IV drug users, and patients with chronic granulomatous disease, impaired neutrophil function, are vulnerable. So Staphylococcus aureus is a leading cause of osteomyelitis in children and adults.